Hi, this is your audiologist. So let's talk about sudden hearing loss today. So what is a sudden hearing loss? Sudden hearing loss is a fall off in hearing suddenly without any sign or symptoms or warning. So now we have to understand the causes of the sudden hearing loss. So causes can be many, but some causes are like poor blood circulation and like tumor or a viral infection. How we can diagnose sudden hearing loss? So diagnosis, you can also understand that a sudden hearing loss happens mostly in the morning time. When you wake up from bed, you will get a blockage sensation or fall of hearing, or you will get some ringing or buzzing sound inside your ear, and it is mostly will be causing only one ear. In rare cases, you see it is on the both sides. Then immediately you should consult an audiologist to get a proper diagnosis. Okay. So now what audiologist will do? Audiologist will assess with certain tests. Okay. Then you can only understand whether this is a sudden hearing loss or any other type of hearing loss. So now we have to seek for treatment and management. So treatment is like after you are diagnosed with an audiological report that this is a sudden hearing loss, then immediately without delaying you should consult an ENT doctor for further treatment. So treatment includes mostly steroid. Steroid can be given orally or intratympanic. So the ENT will decide how will be the treatment plan. For more, you need to consult an ENT. Now we need to understand whether this is an emergency case or not. Yes, this is an emergency case. Though this is not a life-threatening, but it is an emergency because you have always a chance to get your hearing back within a certain time frame. Like the time is when you got the hearing loss, it is 48 hours to 72 hours, but the time ranges from till 15 days. But if you consult prior, the prognosis will be higher always. So if you delay to consult, then the temporary because sudden hearing loss is a temporary hearing loss. The temporary hearing loss turn to permanent hearing loss. Then we have to manage it because we can't cure. If it is permanent, then we can't cure it. And management has to be done with and only with the hearing aid. There is no other way. To get a hearing aid, you need to consult with an qualified audiologist, because to find a precise hearing aid, you need to consult with a qualified audiologist only, because you can't put any hearing aid which is available in the market, because to find out which will be the more suitable hearing aid for you, we need to do certain tests, and then we conclude that okay, this is the particular hearing aid which will help you. So we need to understand the precautions. So basically, primarily how we understand the world by three senses. One, hearing, second, vision, and third, touch. So these three senses are very important to communicate. Though sensory neural hearing loss is not a life-threatening, but it can affect your day-to-day activity, and it will cause very difficult for us to live in the environment because we can't able to communicate with people. Also, it will affect the cognitive processing. So we need to be careful and alert as the sudden hearing loss is irrespective of time or cause, but still we can take some precautions. We can still be alert by using less headphones or less exposure to loud noisy environment. If you are exposed into loud environment, then you should put your protection devices, and also whenever you see this sudden hearing loss is happening to you, should immediately consult to doctor. Now we need to understand that who might get affected with a sudden hearing loss. So sudden hearing loss can happen to anyone irrespective of age or gender.